Okay, so now we're going to talk about how to assess the ileocecal valve from a bottom-up fashion. And the bottom-up fashion just implies that there are structures in the lower half of the body that can negatively impact the ileocecal valve. In the paper I wrote, if you read it, you'll find that the mesentery is a major issue. But how do we assess mesentery? Well, we know, based on the writings of Dr. Goodhart, that the mesentery gets torqued and twisted and can cause all kinds of pains at the area where it attaches. And so we know that it attaches to the small intestine, the sigmoid colon, at the ileocecal valve, and all the way to the posterior aspect of the abdominal cavity and the spine. So many times back pain is a result of an ileocecal valve problem because of the mesentery. And it's very simple to assess. All we have to do is challenge different parts of the mesentery against the tensor fasciae latae. So make sure the muscle's intact, hold. And there is a transverse mesentery. So we're going to just irritate and move that back and forth. Hold. And if it's torqued, we go into weakness. Right here is the ileocolic mesentery. Hold. She goes into weakness. Over here is the sigmoid mesentery. Hold. She goes into weakness. And if we just give a gentle center of the body movement for the rest of the mesentery, we don't get much of anything. So we know we have 1, 2, 3 areas that we need to work on when we're helping the valve. And how do we do that? Vibratory forces, gentle visceral manipulation that just restores normal motion, and that manipulation is done with hands-on, feeling for gentle motion, and I'm going to do it now. And we just follow the motion until the body settles. And there's some settling right there. So we'll recheck. She didn't know I was going to do this. We'll recheck the sigmoid, not the sigmoid, but the ileocolic mesentery. Hold. And she's strong. It won't stay. She still has to go home and push up on the valve. She still has to do other things. But this is an important part of managing the ileocecal valve syndrome. Thank you.